In this video, I'm going to talk about the embryonic development of the heart, and there are embryonic structures that are listed here, for each of which you will have to know their adult derivatives. So let's first get the easy ones out of the way. So truncus arteriosus is the structure that gives rise to aorta and the pulmonary trunk. Primitive atrium is the structure that gives rise to the trabeculated portion of the right and left atrium, while primitive ventricle is the structure that gives rise to the trabeculated portion of the right and left ventricle. Now, if you've noticed, the ventricle here is higher than the atrium, but then there would be a rotation of these structures, and eventually atrium will go higher versus ventricle, which goes lower in the adult heart. Now, I would like to discuss structures that arise from bulbus cordis and sinus venosus. So bulbus cordis gives rise to the smooth portion of the right ventricle, as well as the smooth portion of the left ventricle, and you will have to know their scientific name. So the smooth portion of the right ventricle is called conus arteriosus, versus the smooth portion of the left ventricle, which is called aortic vestibule. And then you will have to know what structures arise from the right and left horn of the sinus venosus. So right horn of sinus venosus gives rise to the smooth portion of the right atrium, where great vessels like inferior vena cava empty the oxygenated blood. And the scientific name for this structure is called sinus venarum. So the smooth part of the right atrium that arrives from the right sinus venosus is called sinus venarum. And then we have a left horn of sinus venosus, which gives rise to the coronary sinus. And this is the smooth region where blood from the coronary vessels empty into the right atrium. So let's go through this table and fill that together. So as we discussed, truncus arteriosus gives rise to aorta and the pulmonary trunk. Primitive atrium gives rise to the trabeculated portion of atria, versus primitive ventricles, which gives rise to the trabeculated portion of the right and left ventricles. Bulbus cordis gives rise to the smooth portion of the right and left ventricles. Right horn of sinus venosus gives rise to sinus venarum, which is the site where great vessels empty the oxygenated blood. So let me show that to you. So here is sinus venarum in the right atrium, and that's the site where great vessels like superior vena cava and inferior vena cava empty the oxygenated blood. So this smooth portion is arrived from the right horn of sinus venosus. And then we will have left horn of sinus venosus, which gives rise to the coronary sinus. And coronary sinus is the site where vessels that feed muscles of the heart empty the oxygenated blood. So let's go back to this image again. So here would be coronary sinus, which is arrived from the left horn of the sinus venosus. Alright, now let's go through this table and just summarize what I explained there. Truncus arteriosus gives rise to aorta and pulmonary trunk. Primitive atrium gives rise to the trabeculated portion of the right and left atria, versus primitive ventricle, which gives rise to the trabeculated portion of right and left ventricles. Bulbus cordis gives rise to the smooth portion of the right and left ventricles, versus right horn of sinus venosus, which gives rise to the sinus venarum, and left horn of sinus venosus, which gives rise to the coronary sinus. Now I have a memory aid here that will help you memorize what structures arise from bulbus cordis and sinus venosus. So you can see how bulbus cordis is here in the ventricular region, so therefore smooth portion of right and left ventricles are arrived from bulbus cordis. And then we have sinus venosus here. So we have two sinus venosus, one in the right side and one in the left side. So the right sinus venosus gives rise to the smooth portion of the right atrium, which is also called sinus venarum, and it receives blood from the great vessels. And then the left horn, it's like C and an S inside, gives rise to the coronary sinus, which receives blood from the muscles of the heart. And that concludes our discussion.